appreciate all of you coming this afternoon. I'm going to tell you a little bit about my background, and then hopefully I can make the next 30 to 45 minutes valuable for you. I was able to talk with 6 or 7 of the folks that are here, and so I understand we have a lot of people from the lending world, and so I'm going to actually fashion my speech a little more towards that than it was before. I'm pretty confident that I can tell you some things that will be helpful to you. My background is that my wife and I met in law school, the University of Kansas. Met on the second day. We got married the second year of law school. We ended up in the Kansas City area and thought we were going to practice law for the rest of our life. But I happened to kind of stumble into an assisted living facility in the early 90s, at which point assisted living was pretty new. And I thought it was such a brilliant idea to have a residential setting to take care of older people that I talked Stacy, my wife, into us building a facility. Kansas does not have a certificate of need, so we were able to just have an idea to do it, and we did it. And this was in the early years of assisted living where it was so popular that you would literally open up full. In fact, the business model we copied with Sunrise, you could charge people a fee to have the right to come in and rent a room. So you were literally profitable from day one. Those were the good old days for sure. After we built our second building, we were discharging people to nursing homes that we couldn't take care of. About 2/3 of the people could live with us for the rest of their life, but about 1/3 we were discharging. We were not comfortable with any of the nursing homes that were in our market. So we decided to build a nursing home. And that's when we did the one smart thing that we've done in our lives, which is that we built our nursing home and then all the nursing homes we built after that, just like our assisted living facilities. So we were building nursing homes in the late 1990s and early 2000s that were all private rooms that had, they were single story, but you'd walk in and the center part of the building was a 20-foot ceiling because we built little cities, movie theaters, town halls. You've seen them now. Other people do them now, but this was back in the late 1990s, early 2000s. Brookdale heard about us. They came out. They wanted to get into the nursing home world. They came about us. We weren't looking to sell, but they toured our facilities and they said, this is what we want to do. And so literally 45 minutes after I met Bill Sheriff, who was then the CEO at Brookdale, we sold him our business. That allowed me to get back into politics. I'd been in politics all along in the state legislature in Kansas. Some very weird things happened, and I ended up as the governor of the state, and that was great, and I enjoyed that immensely. When that time ended, I didn't run again in 2010. I got very lucky. The CEO position of the American Healthcare Association came open, and a combination of the fact that I had been a governor and that Stacy and I not only built buildings, we worked in them on the floors for 10 years, made me an interesting candidate. And I was selected to run AHCA, and I did that from 2010 to 2014, and then just retired in January of 2015. I now am on the board of Ensign, which is a large nursing home company. I have a website that I'm going to tell you about here in a little bit, and then I'm also very involved with a company that puts physiatrists in nursing homes. So more or less since the mid-1990s, I've been working pretty much 7 days a week in the nursing home sector. I interact with lenders a lot. We were our regional bank's largest customer, so their strategy for retention was to put me on the board, and I greatly enjoyed that. I've been spending 20 years screaming at people that they need to refinance everything to HUD, and some of them listen and some of them haven't. So I think I understand a little bit about the world that many of you come from. As we sit here today, the skilled nursing world is at the best position that it's ever been. So I don't know, I talk to some vendor partners who don't realize that, but the nursing home world right now is killing it. It's doing really, really well. And I'm going to talk about where we're at and kind of where we're headed. And then if we have any time left, I'll leave time for questions. I'm going to assume, are there any operators here? Did any operators come in at the last? Okay, that makes it easier. Okay, so I'm going to focus on, kind of as a vendor partner from the finance side, some things that I think you need to know. Okay, so let me start out with I'm going to talk about the here and now, and then I'm going to talk about the future. So the here and now is really, really good. And I don't know if can we get that, if I move, will I not be at the top of that, or can we do something? There we go, perfect. This is a chart of SNF occupancy since before the pandemic until now. And historically, nationwide SNF occupancy has been at about 80%. Obviously, during the pandemic, we were crushed overnight. We dropped 13%. And the big discussion point was, are we going to survive at all? It wasn't at all clear that people would be willing to come back to nursing homes. It wasn't clear how many people would die in the nursing homes. It wasn't clear if the public would ever accept us. Financially, we had no way to survive the pandemic because of this. We needed a lot of things to go right in order to survive. Well, the good news is they all went right. First of all, everybody didn't die. Our occupancy went down 13%, but it didn't go down to zero. Secondly, the government gave us substantial amounts of money, both at the federal level and in most states. Thirdly, we were worried about the plaintiffs' lawyers. They didn't sue us out of existence, and that's primarily because every building ended up getting COVID. So that the original theory was, oh, if you got COVID, you're a bad provider, we're going to sue you out of existence. It didn't work when everybody ended up getting COVID. And the public came back. The public said, okay, we get it. This was an anomaly. This is not the way it is. We're not going to give up on the nursing home sector. So it was excruciatingly slow, but recovering at a rate of about 2 or 3% a year. Last year, we came back to where we were. The good news, and I'll get to it in a minute, is it's just going to get better from here. It's very, very likely it will just get better from here. The other thing in the here and now is that our workforce came back. We had something happen to us that had never happened before, not just in the history of the nursing home sector, but to any healthcare provider. And that is that a material number of our workers just said, I can't do this. So we started out the pandemic with about 1.6 million workers. Over 250,000 of them left. They just said, it's too hard. I'm not going to do this anymore. That put us in an impossible position for those years that we were in recovery. We were dramatically understaffed. We had to go to agency. The agency prices got extremely usurious. I mean, people are charging $100 an hour for a CNA. It was really, really bad. But as you can see from the chart, it's taken forever, but we're now back to where we were pre-pandemic as it relates to workforce. So we have gone from a period in early 2020 when it wasn't at all clear that we would survive to being back to where we were before the pandemic, and I would argue that we're actually doing even better, and I'll talk about that in just a second. One of the things that's happened in the last 20 or so years is that the sector has gotten very good at defending itself. There are many healthcare providers, groups that are out there that are just not good at it. The hospitals, for example, people think, oh, the hospitals are so powerful, they get cut all the time. They're really not that good at lobbying. The doctor groups are quite bad at it. They fight with each other all the time, and so if you look at doctor reimbursement over the last 20 years, it's basically flat. The good news is that I think that we got so used to losing in DC and in some extent the states that we decided we need to stop losing. And the sector has more or less unified so that in DC there's now one voice, the American Healthcare Association, and they have been doing pretty darn well. So, that's kind. Thank you. That's nice. That's nice. That's nice. Jim, that's nice. That's kind. That's very kind. So what's happened this year? And this is under Cliff Porter's leadership, who's doing a great job in succeeding me. We avoided a Medicaid catastrophe. Now think about this for just a second. Congress passed a bill last year that said that every single healthcare provider in the country is going to have their provider tax rates reduced, the amount of money they can get through provider taxes, except we're going to make one exception, and that one exception was nursing homes. I mean, that's an astonishing accomplishment that shows you kind of the level that the sector is at right now in DC. For the 14th consecutive year, we've gotten Medicare increases, and it happens so often in the sector that people just take it for granted. the doctors' rates get cut all the time. Ellie and I are here with this company called CRC, where we employ over 400 clinicians, and our rates got cut last year. I mean, it's just amazing. These doctor rates, just don't keep up. And finally, on the assisted living side, the associations have been successful in avoiding federal regulation. So things are good at the federal level. In 2026, things are likely to continue to be good. We think we'll get another Medicare increase. We think we'll get some regulatory relief. Things are really pretty fine at the DC level. The big question now is the states. Even though the feds did not cut nursing homes because the states are getting less money, there's the concern that the states will cut the Medicaid rates. In general, though, and I have nothing to do with this, the state associations have done a very good job at getting Medicaid increases for providers. And I was having a discussion with some folks this morning. When I started at ACA 20 years ago, 16 years ago, there were only about 5 states in the country where providers broke even on Medicaid. There's about 30 now. And so if you break even on Medicaid, you're in a really good state because you're going to make money on all your Medicare patients, you're going to make money on all of your ancillaries. So as we sit here today, there's really never been a better time to own a nursing home. Now, there's only 3 publicly traded companies, so there's not that much information out there. But 2 of them, Ensign and NHC, are at all-time highs. And PACS would be at an all-time high if it weren't for the regulatory issues that it's had. I mean, you can look at the earnings reports, you can look at the financials that are filed on public companies, it's going well. You guys see all the stuff for your underwriting, so you see that, at the state level, it, again, not every state, but in most states right now is a really good time to own a nursing home. Future will be about the states, and I've already talked a little bit about that. Okay, so now I want to talk about 2 enormous megatrends that are really good. One is really good for us, and one is challenging, but both you need to know about. The first that I know that you know about, but I just want to talk about it in a little more detail, is the aging of the U.S. population. Ever since Stacy and I have been involved in this, starting in the mid-90s, people would come up to us and say, hey, it's so smart that you're doing this because all these people are getting old. Well, in the mid-90s, the baby boomers were turning like 50 and 55 and 60, and maybe some of them were turning 65, but that doesn't help the sector because the people that live in our buildings average 83 years old. And so for a while, I would correct people and say, hey, it doesn't matter that people are turning 60, and then I just stopped saying it. But I said to Stacy, if we can make it until the year 2020, we're going to be fine. And that is because of this data right here. And this is why you are in the right space. There have been times in the past where it hasn't been that great, but you are in the right space right now. This is a chart of the number of people in the United States that are over the age of 80. And if you look back to 2025, last year, there were 14 million people in the US over 80. If you look just 5 years from now, it's 18 million. Another 5 years from then, another 4 million, then another 4 million. And then it gets all the way up to 30 million people. Now, this is very, very different than what we've experienced over the last 15 years. Between the years 2000 and 2015, there were actually years where the number of people over 80 declined. And that's because during the Great Depression, there was a massive drop in the birth rate. And so hundreds of thousands of babies that would have been born in 1930 weren't born. They would have turned 80 in the year 2010. They weren't born. The sector actually went through an excruciating period of time between 2010 and 2015 where our customer base did not increase. But our utilization was declining because the managed care companies all wanted to shorten our length of stay. And people were leaving SNFs to go to assisted living and all of those other pressures. Those were really tough times. But now it's completely turned around. Starting last year, we add like almost 1 million potential customers a year. Yes, utilization will continue to decline a little bit, length of stay will drop a little bit, home health will pick up some of these folks, but this is so compelling that occupancy is going to increase. And again, if you look at the public traded companies, and Ensign, for example, the one that I'm on the board of, Ensign's record occupancy until the end of last year was 81%. We ended last year at 83%, and that's with no occupancy initiative. That just happened naturally. It happened because of this. And at the very time that this is occurring, the number of nursing home beds is declining. We're losing about 500 nursing homes a year. Now we're building about 200 or 300, but net, we're still losing a couple hundred buildings a year. Even if the market recognized this and decided to respond, it would be hard. First, because the CON in many states is pretty serious. In many states, the certificate of need really does keep people from building new buildings. And second, even if you wanted to build new buildings, by the time you start to think about it to actually have people moving in, it takes 3 to 5 years. So for the next 3 to 5, 10 years or so, this sector is going to be in an amazing place as it relates to occupancy. Each 1% is basically an additional resident in a building. Typical building's about 100, 120 beds. So if you go up 1%, it's one resident. Even at a bad Medicaid rate, that equates to about $120,000 in income for one resident, and the extra cost is maybe $15,000 or $20,000 a year for each additional resident. You don't add a new staff person just because you've had an additional new resident. So that's why Ensign and NHC are trading at record highs. That's why people are buying buildings that are, look crappy and have 2 and 3 people do a room and they're paying, $150,000 a bed or whatever. It's because of this, and this is going to continue. Now, megatrend number 2, a lot of people know about. And this, to me, is one of the most interesting things that's happening, not just in the United States, but it's happening in the entire world. And if you don't know about it, now that I'm telling you about it, you're going to start to hear stories, and this is going to start sinking in. And that is that the number of younger people is declining. And it's not just declining in the United States, it's declining in every industrialized country in the world. And this has enormous ramifications, mainly bad. So this is a chart of the US population increase since 1900, and we have really good evidence of this. We have really good data because we've always had this big thing about our annual or our 10-year census. So we know what the population was. To get to a negative population, you would have to go below that bottom line. So what that means is that we've always had growth. But it's unmistakable that that growth rate is declining. If you look at the middle of the chart, which is 1950, starting at about 1950, the birth rate in the United States started dropping dramatically. And I don't think that's going to turn around. People just aren't having babies in the same numbers that they were before. This is a phenomenon that's not just true in the United States, it's true everywhere. For whatever reason, once countries become somewhat wealthy, the birth rates start to decline. And the country that is at the forefront of this is Japan. And let me explain, and then I'll tell you why I'm telling you about Japan. So in Japan, Japan's population peaked out back around 2010 at 125 million people. The birth rate is barely over 1. Obviously, you need a birth rate of 2 in order to sustain your population. They are almost below 1 as a birth rate. As a result, it's projected that the population of Japan will drop to somewhere between 55 and 95 million people. Now, this has incredible ramifications. First of all, there just aren't young people around anymore to work. But more important, there aren't young people around to buy anything. Older people buy less of everything except healthcare. Once you get to be over 70, you buy less cars, less clothes, less vacations, less everything except healthcare. The people that make an economy go, that are buying homes and vehicles and clothes and vacation, it's younger people. If you own a business in Japan, you are completely screwed, unless you sell healthcare. Because if you sell anything else, you got a lot fewer customers. Japan is in real trouble. This chart, although not quite this dramatic, is true all around the industrialized world, including Western Europe. And here's the crazy thing, and I certainly wouldn't call China an industrialized or developed country, but China also has a massive population problem. Because of their one-child policy, which they've reversed, but they now can't talk people into having kids, Japan's population is likely to go from almost 1.5 billion to somewhere around the middle 700 millions. Now, I'm not going to live long enough to see this. Many of you in the audience will. 20 years from now, you're going to hear a lot about this. This is a massive problem. You know how countries' GDPs, gross domestic products, increase every year, and the GDP for the whole world just keeps going up and up and up? It's going to be really, really hard for that to happen when in the industrialized world there are fewer people. I just think this is a cool thing to know about and to think about, and so I wanted to share it with you. But it also matters, bringing it back to the nursing home world, it matters to us. And that is because there just aren't going to be enough young people in the US to take care of all the old people. So I asked the team at the American Healthcare Association to put this chart together for me, which is the number of people between the ages of 18 and 45 for every person over 80. And back in 2022, there were 9. This is moving so quickly that by last year we were already down to 8. 4 years from now, we'll be down to 6.5. 5 years after that, we'll be down to 5.5. Finding workers will be really, really hard. Now, we could sit and talk about this for hours, and we won't do that because there could be a saving grace. The saving grace could be AI. It is possible that AI will displace a bunch of other workers in other sectors, and maybe it'll be easier for us to find long-term care workers. It's hard to know. If you spend any amount of time on the internet just studying whether or not AI will create or eliminate jobs, nobody knows. There is no clear consensus on it. Some people are certain it's going to create a ton of jobs, other people are certain it's going to create massive unemployment, and many other people are in between. So I think we can only act upon the best evidence we have, and the best evidence that we have is there aren't going to be very many young people to take care of the old people. What does this mean? This is awesome news for your customers that are great providers. If you are a great provider and understand the importance of employee engagement and satisfaction, you understand the importance of keeping turnover very, very low, you will crush it in this environment. For those of you that were here on the last panel, which was Journey, who are a very mission-driven organization, very focused on employees, et cetera, this is great news for Journey because they're going to be able to find workers when their competitors can't. The ramifications of all this are that employee engagement and turnovers are the key metrics that we will face going into the future. Turnover matters for a gazillion reasons, and if we had a bunch of operators in here, I'd spend some time on this chart. I won't do it though, but just trust me, turnover is a key metric. As you are underwriting deals for potential customers or trying to figure out if somebody's a good provider or not, there's a lot of data that you can look at. You need to look at their turnover rate. The average turnover rate for nurses is around 50%. If they're above 75, they're probably not a very good operator. If they're below 50, they really, really know what they're doing. I think the two most important metrics in evaluating any provider are employee turnover and rehospitalization rate. Employee turnover because it tells you so much about whether they're a mission-driven organization that knows what they're doing. Rehospitalization because it's so critical in so many payer formulas, and in order to be good at rehospitalization, you have to be good at a lot of other things. So, to the financiers out here, I would just encourage you to think a lot about about turnover. Okay, in my last year at ACA in 2014, I worked on a project where we ended up writing a book about the very best nursing home companies in the country. And what had happened was that over the prior 10 or so years, our chief medical officer and I, a guy named David Gifford, who worked on the book with me, had been talking about how so many of the really good companies were doing the same things, and so many of the companies that weren't very good were not doing these things. And before we left ACA, we needed to write this down so that people, not just to celebrate the companies that were doing well, that really wasn't the purpose of the book. The purpose of the book was to provide a template for people that want to get good. And so we put out this book called Long-Term Care Success, How Senior Communities Thrive Clinically and Financially, and we've made it very hard to buy it. We're not very good at marketing. The only way that you can buy this book is that you have to go onto the ACA website, ahca.org, and I think that will, if you Google up Mark Parkinson ACA book, it'll find, and you can order the book that way. In the little world of the nursing home world, and it is a little world, there's only like 1,000 nursing home companies, this has become a pretty popular book. And there are a number of companies that have bought the book for their entire clinical teams, and they've tried to mimic a lot of the really good practices in the book. It's actually in its third printing right now, but there are still some copies that are left on the website. Okay, so again, I was gonna spend a lot more time on this if we had operators, but I'll just spend this a little bit of time. There are, at least my takeaways were 4 key functions, four key characteristics to the highest performing organizations. And I'll just cover 2 of them, and then I'll cover one that's not up here because it's more relevant to you. The 2 that I'll cover is that every single one of these organizations is highly mission driven. And we didn't just pick companies that we liked or that were popular. We had a whole bunch of different clinical measures that we measured them on, and we had an objective way of picking what we viewed as the best companies. All of them are mission driven companies, like Journey's mission to change the world by improving one heart at a time. All of these companies have compelling mission statements that drive their behavior, that they truly believe in, and that are compelling and cause them to work their tails off. The second thing that they do is that they link outcomes, both financial and clinical outcomes, to significant bonuses for their successful operators. So the average nursing home administrator in the United States makes $130,000 to $140,000. Some of the administrators in these organizations are making $400,000 and $500,000 because they're achieving all of the goals that are being set for them, whether it's occupancy or 5-star or survey results or whatever. They're all doing that. The final thing, and again, I didn't put it on here because I thought we were going to primarily be talking to operators, but absolutely critical to these companies is that they have almost no debt. Most of them have limited debt that they have ultimately taken to HUD. So they're dealing with a non-recourse, long amortization, relatively low interest rate. If you look at the large companies in the space that failed, you know, the Manor Cares of the world, the Golden Livings, the Beverleys, all of those that were out there in the past that got quite large, they got too embedded with debt. Either there was a real estate transaction that allowed them to pull out a ton of money at one time, or there was just debt layered on top of debt. They just didn't have any room for error. So again, as you look at deals and look at what makes sense and what doesn't make sense, there has to be a margin for error. There has to be some level where, if all of a sudden Medicaid gets cut X, or all of a sudden if there's a staffing mandate that's Y, or if there's a bad survey and they lose their admissions for a while, there has to be an area of safety that the building or that the company can still survive. And I know that you know that, but I still see people out there leveraging up to levels that are they're going to come back to hurt them in the long run. The highly successful companies have basically never done that. They've kept their debt relatively low and they've kept it manageable. Okay, I was thinking to spend a bunch of time on some of the best practices for how to keep employees happy. I won't do that. But the implication of all of this data is that good providers will be hyper-focused on employee satisfaction. If you're underwriting a loan for somebody and they're not measuring employee satisfaction, if they don't know what their turnover rate is, I think there's a problem. And again, I would just really focus on that. The other thing I wanted to tell you about is that in retirement, Mark Zimmett's a reimbursement expert. Mark and I have put up a website. It's at parkplacelive.com. It is more or less an extension of the book. The purpose of the website is for people that want to be really good providers to help them be really good providers. Patrick Knoll, who's the former editor of Provider Magazine and who edited our book, is our main content person, and he's posting content on the website every day. Mark Zimmett and I are posting stuff on the website almost every day, and there are some very cool free interactive tools on the website that you might want to play around with. There's a state map where you can scroll across, and there's 25 metrics for each state. You know, how many nursing home beds do they have? What's their occupancy? What's their MA penetration? Those kind of things. In 2 weeks, we're going to post a nationwide map that then grades each state on whether it's easy or hard on a regulatory basis. We've got 12 metrics that we use to judge whether a state is very punitive or very helpful or somewhere in between. So there's some cool stuff on there that I think that you might find. I'll close and we'll see if there's any questions with just this thought. Again, I think you're in the right space. I'm not sure we could say that over the last 20 years. And if you've made it here, you survived the last 20 years. The demographics were actually not that helpful for us. There were a lot of competing interests in what we were doing that made this really hard. I think that the tailwinds are at our back right now. I also believe that among owners and operators generally, there's a real appreciation for the fact that the sector survived through the pandemic, and I almost universally an unspoken commitment to not screw this up. And we could screw it up. It would be very possible to screw it up, but I think there's a real commitment to not do that. So we've been through hell and back in the pandemic, but as we sit here today, I think we're in really great shape. And I hope that I gave you some piece of information today that will be helpful to you. Thank you very much. We do have a few minutes. If anybody has any questions, I'm happy to try to answer them. The things I know more about in life than what I just mentioned are the Kansas City Chiefs, our 2 grandchildren, sports in general, horse racing. Any of those topics plus long-term care. Anybody have any questions? Yeah. Okay. Yeah. It's a great question and one that I spend a lot of time thinking about, and a lot of people are thinking about it. The political lineup that we have right now in DC is okay, and it is actually likely to get better in the midterms, because in the midterms we will probably end up with divided government. And in general, divided government where one party doesn't have control of everything helps us. That's generally good. So at the federal level, it would be hard for this thing to get messed up for like the next 3 years. If, however, one party takes over and has a massive mandate for action, that's always worrisome. For example, what we just had, the Republicans came in, they had control of everything. There was a major run at Medicaid. If SNFs had not been carved out of that final big, beautiful bill, we would have had a real problem, because provider tax revenue basically got cut in half. So one thing that we have to make sure that we continue to do is we have to be very active politically and on the lobbying side. And so that's where it's really important that we have strong state associations, strong national associations that do the legwork and make the commitment to stay super involved politically. I think that our biggest risk, there's some risk that we control and some risk that we don't control. Among the risks that we don't control are just like the macro economy. If the macro economy goes bad, and when we have our next recession, and it's inevitable that we will, states will be scrambling for money even more than they are right now, which makes it very, very hard to protect the Medicaid rate. But there's not a lot that we can do about the macro level, other than just be in as good a position as we can be lobbying politically, et cetera. The risk that we have some control over, I guess you could argue we have complete control over, is our quality of care. If our quality of care goes badly, if there are horrible stories of folks just intentionally providing lousy care to make money that aren't at all focused on clinical outcomes, that's where we run into trouble. The entire regulatory scheme for nursing homes, which came about in the 80s, happened because of a book that was a book about how terrible it was in nursing homes. I think that generally the level of care in nursing homes has improved over the last 20 years. I think by any objective standard that's the case. But we do run the risk of a few isolated operators just not doing a good job and creating a major focus on us. I think the other risks that we run are mainly political risks that we have some level of control over. But I don't really know. I mean, what do you have an answer to that? Everybody keeps telling me this can't keep lasting forever, and I agree with that, but I don't know. What do we need to worry about? Yep. Yep, agreed. Anybody else? Yep. Yeah. I'm not worried about them. And so a normal talking point for a Republican or a Democratic politician is we have a whole bunch of people in nursing homes, they're trapped in nursing homes, and if we just had a waiver program for them, they would be taken care of in some other setting. And what that tells me when I hear that speech is those people have not been in our buildings. Because if you come into our buildings, the people that we are taking care of are much older and much frailer than these politicians understand. And they're not capable of being taken care of in another setting. So what ends up happening when you create these waiver programs is that the population in the nursing homes really doesn't decline. It just creates a new benefit for people that are in the community. And so there have been real attempts by some states of, we're going to decrease the population of nursing homes by 15% by having all these waiver. It doesn't work. Because again, walking through our buildings, you see, oh my God, these people are, their needs are immense, and they're not going to be taken care of at home health, or in most cases even in an assisted living facility, in an assisted living setting. So I don't view them as a big risk. Oregon, for example, which obviously, as you indicate, has a wonderful waiver program, is also probably like the best state in the country to own a nursing home in. So people are crushing it in Oregon. Yep. Okay, so what was the first part of your question? Yeah. So the concern has always been that there would be federal regulation of assisted living in the same way that there is skilled nursing. I don't think that's ever going to happen. The political lineup that it would take to do that would be extraordinary and just very, very unlikely. The lobbying groups in DC are strong enough, I think, to keep that from happening. But to your point, I think there will continue to be robust regulation at the state level, which is okay in most states. I mean, in most states, it's much easier to deal with the state legislators and the state regulatory agency than it is to deal with Congress and with CMS. So each state needs to have its own strategy on this. There are some states where there's basically no regulation of assisted living. I think that's a bad idea. I think it's a recipe for somebody to come in with something really onerous. And if I had my say in those states, I would be putting together kind of like a wish list prototype regulatory system and trying to get that implemented as opposed to basically nothing. But I think that AL will continue to be largely unregulated at the federal level, which makes it incredibly attractive. I mean, I know that we're sitting here talking about the SNF world, but the investment opportunities in private pay, AL, private pay, IL are unbelievable for the same demographic reasons that it's true in SNFs. And I think those will continue to be amazing investments for a long time. I mean, personally, I'm invested in the private pay AL sector, which I think is very attractive. Anybody else? Okay. Well, thank you all very much.